Welcome to Lotus Health Education and Wellness Empowerment through Health Enlightenment. In some of our recent videos, we've been doing a series on cardiovascular disease, specifically focusing on things that we can do to control issues like high blood pressure, high cholesterol, and we'll be looking very soon at things associated with diabetes and its impact on the heart. However, with our most recent video, which you can take a look for the description here, and you'll find the link to that video, we've been looking at labs and how they play a role in our ability as your healthcare team to help you manage your cholesterol and controlling some of the things that happen with cholesterol that can contribute to atherosclerotic cardiovascular disease, or ASCVD, which are often those things where plaques build up and changes happen to arteries and the associated vein structures and other sort of highways, if you will, of the blood to and from your heart that can lead you to developing things like heart attack and stroke. We looked most recently at our basic lipid panel and what we measure as part of that and how we use it to try and help provide you the best care possible. And as promised, in today's video, we're going to be talking about the advanced lipid panel, which looks in a little bit more detail using those basic lipid panel results as the foundation, but building on it to provide even more information to help you live even healthier and help us as your healthcare team work with you to make great decisions to try and help manage any potential current or future health issues you may have. Before we go any further, remember, if you're not already subscribing to this channel, to hit the subscribe button and give today's video a like. It's really helpful and it'll make sure you get future content that we're going to be providing here on our channel. It's also important, before we go on, to stress the fact that the information that we're going to give in today's video is solely informational. It's not intended to replace any information or input from a specialist or a primary care provider, whether it's a physician or an advanced practice practitioner that knows about specific conditions you have and is going to be responsible for your care. Even though we appreciate the trust that you place in us and the information provided, make sure to consult with your healthcare team before you make any changes to your health routine and that it's right for you. So, without further ado, let's jump into the advanced lipid panel by going to the board to take a look at some information. So, as you can see on the board, we have some information here for you on why, before we even talk about anything else with labs, why it's important for us to pay attention to what's going on, not just with your basic lipid panel, which again, you can find the video for in the description below, but also to take a look at some of the things that we're going to see today with the advanced lipid panel. We're going to start off with a cross section with this incredible artist drawing, which, in case you couldn't tell, I drew it, of a cross section of an artery. And you can see, starting off from the left-hand side, that the artery is healthy. And this is how our arteries should look. In fact, most of these major vessels, again, that lead to and from our heart, we should want them to be clean and normal, meaning that there's no signs of blockages or buildup, or, as we've come to importantly find out, inflammation. We've heard a lot about it in the last several years, that conditions that have inflammation associated with them, or things that have the potential to cause inflammation, were a really big concern throughout the course of the COVID-19 pandemic. And as we found through research over the course of many, many years, inflammation plays a critical role in what happens with our cardiovascular system, or our heart, and all of the associated structures that go with it, and our risk factors for developing any sorts of blockages or other concerns that can lead to a heart attack and or a stroke. So if we're taking a look here at what's happening to our artery, as we make certain decisions with our lifestyle, whether it's things that we are eating, things like consuming alcohol or smoking, all of these things can be contributing factors to the initiation of early disease, which you can see here is marked by inflammation. And we begin to see some changes happening in those early stages during that early disease inflammation, where the structure of that vessel begins to get thicker and blocked up by the formation of plaques and other substances that change the way that normally smooth and clean inside of your artery looks. If you don't make changes, either because you know that you have a personal risk factor for cardiovascular disease, you've got extensive family history, any of those types of things, At this point in early disease, there could be things that prompt you as an individual to make changes to be able to catch all of this before it gets worse. If you do not, then we progress on to advancing disease. And at this point, we will mark this, if we were to be able to look inside of the vessel itself, by the start off of the formation of plaque. And so that plaque is going to be a collection of all of these different fats and things that we are putting into our bodies. And then our bodies in turn, again, in our liver, convert into substances that become part of our cholesterol. And eventually, because of our dietary practices, not exercising, again, things like smoking and alcohol consumption, and those personal risk factors that you have because of genetics from your family, that plaque starts to build up in those surrounding structures of your heart. And this is where we begin to see that very early but advancing disease. Again, if at this point you don't make changes, then we continue on with even more advanced disease. And at this point, we're going to see the buildup of what we refer to as calcifications within the heart. When you have certain evaluations done, especially if you see a cardiologist, when they talk about blockages that are in your heart, they're referring to these calcifications, which again is an even more advanced component to that buildup, that plaque that's forming in your heart and the surrounding vessels. As that continues on, again, if you don't make any changes, then we can see the advancing of the disease even further to where we've got additional plaque buildup. And we can also see that as that plaque gets thicker, as you can see here from the orangey substance that's continuing to grow and build up in your artery, then you can get essentially from there the rupturing, which is the destabilization of that plaque and the release of some of those substances into your bloodstream, and that can travel into other areas of your body. This is a very concerning component to the disease process, and this is the area that we want to try to prevent. And unfortunately, we too often see a lot of people that make it to this phase of the disease process when we're talking about ASCVD. The last phase, which is basically the most advanced component to the disease state, is for it to be now completely or extremely blocked or occluded. And essentially at that point, we can see the buildup of blood clots in that area. And this is where you are particularly vulnerable for a heart attack or a stroke. You can see here that with each one of those little areas, we've got certain markers that we take a look at. In the case of advanced disease, troponins are not something we typically look at on your lipid panel. That unfortunately is what, if you've ever gone to the emergency room for chest pain, that is a laboratory marker that we in the healthcare community look at when we're concerned that you could be at risk of a heart attack. We'll save that one for a different video. But along the way, as we're taking a look at that progression of the disease in your vessels, we will see different substances that are aligned with these different phases of progression towards having that blockage basically building up within your vessel. Now, where the basic lipid panel is concerned, it does provide us some information about your general health. However, the problem is that as all of that progression is taking place within your vessels around your heart, your basic lipid panel may not necessarily give us an indication of what is happening there. We've come to find that particularly the bad cholesterol, or the LDL, in and of itself is just a measure of the amount of that cholesterol that may be found within a particular particle or collection of particles within your bloodstream. The amount of the lipid particles in and of themselves within your body, the rate or the extent of the inflammation that's going on around your blood vessels and your heart in general, the basic lipid panel doesn't give us that sort of information. And so through additional years of study, scientists and healthcare researchers have begun to find those things that have helped us be able to identify even better than your basic lipid panel, you as an individual's risk of developing heart disease and the potential for you having a heart attack or a stroke. And that's what brings us to the content for today, the advanced lipid panel. So let's jump in even further and take a look at what some of those components are. With regards to your advanced lipid panel, they use, again, your basic lipid panel, which is your LDL, HDL, triglycerides, and total cholesterol, as the foundation for building the house, if you will, of that additional image of your heart and what is going on with your heart. So when you get a basic lipid panel, that's going to provide general information about how much fat you have circulating in your blood, about how much cholesterol content you may have in your blood, and those good cholesterol particles, which again is your HDL. But even beyond that, when we order an advanced lipid panel on patients, it gives us a lot more information. Starting with this first section, which is about the particles. Your lipids are exactly what that number and that name suggests. They're particles, and there's a lot of them floating around inside of your body. So when we take a look at the advanced lipid panel, one of the first things that we look at is the particle number and the size of the particles that you have within your blood. We'll take a look at the total volume of these cholesterol particles, and this is again your bad cholesterol that we're looking at in terms of the particle number, to see the actual volume of the cholesterol floating around in these little balls, for lack of a better way of describing them, within your bloodstream and making their way all over your body. Most of us think of blockages and plaque formation and the buildup of your lipids just around your heart. We've actually found that in women, when you have certain types of imaging done of your breast, you can actually see, similar to what we look for in a mammogram to detect breast cancer, there are actually cardiologists that specialize in areas where we can see the buildup of these lipid particles in other areas of your body. The vessels around the breast tissue are one of those other places that we can see signs of cardiovascular disease by having you undergo a procedure similar to a mammogram, and it will light up basically these areas that have blockages from these LDL particles. So when we talk about the particles, this gives us a good idea, not necessarily of that specific thing with the breast tissue, but just in general, how much LDL you have floating around within your body. Clearly, the higher the number is going to be, the more concerned that we are, because that's telling us that if you have a high particle number, you've got a lot of these cholesterol particles floating around within your body. After that, we're going to focus on the size of these particles. So again, where your basic lipid panel just tells us essentially the volume or quantity of that cholesterol within your system, we now want to know, in addition to the particle number or how much of this we have floating around, what size they are. The reason why this is important is that the small particles of LDL are the ones that we're really concerned about. If you think about that cross section of the vessel again that we were looking at the start of the video, you'll think about the fact that if you were trying to put rocks of a different size within a tube, it's going to be very difficult to fit a larger rock into that tube and that block it up. You may be able to push and shove and maybe get a little bit of that rock through the tube, but depending on the size of the tube that you're talking about, which in this case is your blood vessel, it's going to be very difficult for you to push a lot of those larger rocks in there. But if you have smaller rocks, which in this case are small LDL particles, you can picture that a lot of those are going to be able to pack their way into that vessel, and then you're going to end up with a problem. So the more small LDL particles that you have, this is where it becomes concerning. The medium size, we pay attention to those, they are concerning, but again, by far, the small LDL particles are where we're going to have the most worry. Depending on the particular lab that you work with to get your advanced lipid panel done, for the third component of the advanced lipid information for particle number and size, they may give you the large LDL count. In this particular case, the lab that we work with for our results gives back a result regarding the HDL particle size, in this case, the volume of HDL large particles. There is a bit of back and forth in the cardiology community as to what role, if any, the HDL particle size plays in the overall lipid panel in the advanced panel's perspective. However, in this particular case, for the benefit of this video, the idea here is that similar to how the HDL provides some protective benefits in your basic lipid panel evaluation, in the advanced panel, having a larger quantity of the large HDL particle is supposed to provide protection from having your LDL undergo a process that can turn it into an even more harmful substance and allow it to undergo a different type of breakdown and processing. Then after that, we have the particle pattern, where a pattern A or pattern B is what we will take a look at. These different patterns basically tell us about the different collection, if you will, just in general, from typically a blood sample that we will take of you, of the different size particles that you have. So if you have mostly the large lipoprotein with some medium size and maybe a little bit of the small relative to the overall volume, you will more than likely have what's referred to as a pattern A of your LDL. And that's the one that we would prefer for you as the patient to have. Pattern A is considered the better one because in general, when you have pattern A, that means that when the person that performed that analysis on the blood sample that is sent to the lab, they see in a ratio, essentially, a larger collection of the pattern of large and medium size LDL to the small LDL in your blood. If you have more small LDL particles and not as much of the medium and larger size, then you may end up with the pattern B, which is the more concerning because again, the more of those small LDL particles overall that you have is the increased likelihood that you're going to have a blockage building up inside of that tube or your blood vessel, essentially in this case, and those smaller rocks are going to fit their way in there and basically slow down the blood flow and start slowing things up in your system in general and increase your risk for a heart attack or a stroke. So moving away now from the particle number, size, and the overall pattern of the particles, we're going to take a step back to the cholesterol molecule itself and take a look at the next things that we get reported on an advanced lipid panel and talk about your apolipoprotein B and your lipoprotein A, or Lp(a) as they are called. Your apolipoprotein B, or ApoB, as you can see it on the screen, in the most basic sense, and we're just keeping it, very high level here to give you an idea of how the advanced lipid panel works and the different things that we look at. Your apolipoprotein B is helping us understand how the cholesterol is transported around in your body. On the cholesterol molecule, on the inside, you'll find fats and the things that make up the more problematic component of your cholesterol panel, whether you're talking about your basic lipid panel or this advanced panel that we're talking about today. But on the exterior of your cholesterol particle, or that molecule in your body, are these little associated structures. The ApoB helps us understand how the cholesterol, as it's being transported through your body, how likely you are to have a buildup of cholesterol and end up with these plaques and the problematic components to your cholesterol panel. If we look back at our friend, the cross-section of the artery, we will see that you have in the advancing stages where the plaque is building up as we move from a healthy artery now to the early disease where the inflammation is starting and then go to that advancing stage. ApoB is associated with that because with the plaque buildup that we start seeing there, that is where, as well as the calcium buildup that we will eventually also see, ApoB plays a very important part in that buildup of this problematic substance, this plaque within your vessel. And so this is again where understanding the cross-section of your blood vessel and what we're measuring, that helps to understand for us as your healthcare team what is going on inside of your blood vessel. So this is why that basic lipid panel may not necessarily tell us everything. Understanding additional components of your cholesterol like the ApoB is going to help us to understand, okay, this patient has a high ApoB at this point. There's a very good likelihood that somewhere in their heart, which we can tell through things like a coronary artery calcium score or certain types of images that we take of your heart, where we take a look to see if there's blockages, having those lab values along with those other tests tell us on your cardiovascular team what exactly is happening inside of your blood vessel, both in pictures as well as in numbers. So when we see that you have a high ApoB, which you can see the reference value here that a lot of the laboratories use, then we can tell, okay, with this buildup of plaque now, there is something going on in this patient's arteries that we need to be concerned about. And from there, we can coach you on things like the diet that would be helpful, certain things like exercise or other parts of your routine that need to be adjusted. And when it becomes absolutely necessary, things like supplements and medications. Along with the ApoB, we mentioned another thing called your Lp(a). The Lp(a), again, in its most simplistic sense, tells us how sticky the cholesterol within your body is going to be. So again, you have this bigger cholesterol molecule, it's got fats and things inside of it, it's got some ApoB on the outside, and then attached to it is going to be an additional structure, which is what we're looking at with this Lp(a). In our next video, where we talk a little bit about interventions that we can make with diet, exercise, and also supplements and medications specific to this, we'll take a little bit closer look at the Lp(a), because knowing this number also helps us understand in certain cases the types of, if it's necessary, medications that could be beneficial for you. So your Lp(a) tells us about the stickiness of the cholesterol that's floating around in your body, and the higher that Lp(a) is, again, in the most simplistic sense, tells us the likelihood that you have cholesterol that is sticky enough to be building up inside of your arteries all over your body and causing these blockages. So again, this is not something that we would normally be able to tell from a basic lipid panel, and another reason why having that value of your ApoB and Lp(a) is helpful for us as your healthcare team to understanding what is going on with your cardiology status in your body. You heard in the beginning of the video, I also mentioned that with your cardiac issues, whether it is ASCVD or certain other issues that we see with patients' hearts over time, we're not just looking at the buildup of these substances, which is what most of us think of. When you say heart attack to most patients, they think immediately of something blocking their heart, which is very true, as we saw with the cross-section of the artery. However, inflammation, like I mentioned, is a huge component to the disease in and of itself. And again, that disease being ASCVD, which is the plaque buildup and the stiffening and changes in your vessels that can lead to heart attack and or stroke. How we mark what's going on from an inflammatory standpoint and your immune system reacting, because if you think about when you cut yourself, and a day later you might look at the cut and there's some inflammation there. That is your immune system responding to that cut and what's going on at that site, the damage that's being caused. That inflammation is part of the healing process. It's your body attempting to fix something that's happening and it shouldn't be happening to you. The same thing goes on in your heart. So there are certain things that your body does as that inflammation begins occurring from the things that we eat or things we expose ourselves to that cause your immune system to react and begin sending structures that may not normally be there around your heart to the heart and the surrounding vessels and structures to try and stop or heal that inflammation, or that damage, I should say, that's happening and the inflammation that's occurring. So the two other markers that you can see here where we talk about inflammation and your body reacting to things are the high sensitivity C-reactive protein, or HS CRP, which is something that we look at as a marker of the inflammatory process and your body trying to respond to inflammation and damage that's going on. So again, you see a threshold here. We want that to be low. The higher we see that HSCRP is, for us as your healthcare team, a red flag to us that something is going on with your body and it is responding to damage that is going on. Typically where we see this is that calcium buildup where your artery is now becoming vulnerable. From our cross section of the artery picture, we will see the HSCRP playing an active role in that component of the process that's going on in your body. The other marker that we look at here is this other one, LPPLA2, which is the lipoprotein associated phospholipase A2. I have to sit there and make sure I tell you the whole acronym properly, which essentially is telling us as your healthcare team if you have inflammation that has now activated an immune response. When you get substances like bacteria or other things that could be potentially harmful in your body releases these things called macrophages, which are cells that normally float around and help your immune system by essentially responding, taking up things, swallowing them, and trying to help your body deal with things that should not normally be in your system. Your body tries to differentiate between all of these different things that's happening, whether it's a bacteria or a virus or something that goes into your system, or in this case, inflammation that's being prompted by something that's happening with your heart. When your immune system gets activated from what's going on with your heart and the surrounding structures, your immune system will also release these same macrophages that normally help to address infections and other things that may be going on with your body. Those same structures respond to that inflammation and the process happening with your heart and attempt to help address it. So we look at that particular marker, your LPPLA2, as a way of telling whether your immune system is responding, and again, the state of all of that inflammation going on in your heart and the likelihood that you are trending towards having a heart attack, stroke, or just in general having concerns that we need to really sit down and have a deep conversation with you as the patient about in order to address the lab values that we see. And again, there is a threshold that you can see here where we want to keep it below that threshold. Once you go above that, we know that there is something very serious going on that we really want to make sure we pay attention to. So that's our advanced lipid panel. There are, as an important note, some additional things that we will look for with your advanced lipid panel. And so it's important to understand how the advanced lipid panel is done. You should be fasting, just like we talked about in the basic lipid panel video, for an advanced test. The likelihood is quite great that when your doctor or other healthcare team member sends you to have this test done, that they're going to take a sample of both your blood and your urine. And the reason we do this is because we're going to look at both the basic lipid panel results, which are still very helpful and important for us to see, but also portions of this advanced lipid panel require either your blood to be able to evaluate it, so things like your particle number and size, the pattern that you have, that we determine from the blood sample. There are some additional things that we look at as part of your advanced lipid panel, expressly things like your albumin, for instance, which is normally something that if you have kidney issues, you're probably accustomed to hearing a nephrologist talk about that. We actually look at the albumin in your advanced lipid panel because in addition to telling us about your kidney health, the albumin, which we get information about from your urine sample, that also can tell us some very important things, which if you take a look at the description below, we talk a little bit about some of the information associated with how we use in the cardiology or cardiometabolic world your albumin to be able to give us some helpful information about where your heart health is and where it's going. So there are some additional things that we will look at. The full included topics from your advanced lipid panel are going to be found in the description with a little bit of information summarizing some of what we talked about today. So the big question that I often get asked by patients about this is, can I do anything before you start giving me pills and injections and all kinds of things to get this under control? And the answer is Absolutely. There's things with your diet, there's exercises, and then there's also supplements and medications that can help with each of those different aspects of the changes to your artery in general, and then specifically to these different components of the advanced lipid panel. We're going to talk about that in our next video, a little bit about both the non-medication related things that you can do, diet, exercise, and then supplements, and then some of the prescription items that can be used to address these different pieces of your overall health, but specifically these components of the advanced lipid panel. Remember that if you enjoyed today's content, give today's video a like and hit the subscribe button so you can see more of our videos. You can also hit the bell so that you can get notifications on what's going on anytime we post topics, whether it's full-length videos like these or shorts that you're going to see with little pieces of information. So if you want to go back and just review the portion of this with the particle size and number, things associated with your ApoB and LP(a), we're going to have some videos posted as shorts that'll be just a few minutes in length that'll talk specifically about those components. But remember, subscribe and like our content so you can get more from Lotus Health Education and Wellness. So until the next time we see you in one of our videos, stay healthy and well. We're going to have more information coming up on the things that you can do with diet and other lifestyle components, as well as some of the things that you can take supplement and medication wise to keep your heart working and keep you well. So take care, and we will offer you more empowerment through health enlightenment here at Lotus Health Education and Wellness.